Hey everybody, this is, I think, our 10th episode now, our 10th week of the official Ohio City live stream, OHC-TV. I'm really excited to be here after yesterday. How are you doing, Whitney? Yeah, that's about how I feel. Yesterday, for those of you who didn't see it, yesterday Ohio City Inc. had our annual meeting virtually because that's the world we live in now. It's on the Facebook page, so you can go check that out if you want to rewatch it. Otherwise, it's also on YouTube and our website, the Ohio City website as well, ohiocity.org. And if you did watch it live, I apologize for the technical glitches because, well, if you've seen any of these episodes, you know they happen just about every time we try to do anything. So, today we actually have a couple of really great guests on, talking about a really awesome thing that's happening in our neighborhood. We have Katie Davis from MetroHealth and Josh McLaughlin. Did I say that right? From Urban Community School. We have them both here today, and they're going to talk about what's been going on over with the Urban Community School and MetroHealth campus transformation. How are you two doing today? Oh, my bad. Yep. Oh. It's awesome. Awesome. Congratulations on moving into the neighborhood, Josh. We're always excited to have new residents. Oh. Um, Hold on one second. We're having an issue with audio that is coming in. Thank you to all of everybody watching to let us know. Let's see if I can't fix this. Yep. Okay, let's... Yeah, I'm working on it. I don't know why, but none of the audio is being picked up. Hold on, bear with us. In the meantime, I'm going to, so everyone can see it, I'm going to go ahead and put on, or maybe not. There, I'm going to put the video back on so everyone can watch the video about MetroHealth again while I try to figure out why there's no desktops.
The MetroHealth Ohio City Health Center is a collaboration between the MetroHealth System and Urban Community School. It's an exciting time for two organizations to come together to partner to better serve the community.
MetroHealth, our mission is to provide excellent high-quality care to the Cleveland community, and that really means meeting people where they are. And so the idea behind being here in this community is this community that's incredibly important to MetroHealth, and we want to make sure that we're providing the best possible care where they're located. So we're really excited to be partnering with Urban Community School and those families, those students, everyone in this Clark-Fulton area and Ohio City in general to have sort of a quick and easy place where they can get amazing care.
It has been very exciting for our system to have a brand new building. We've been down the street for many years, and so when this opportunity came to build a new space that would better serve our community members, better serve the youth in our community, it was really a great opportunity.
It's a beautiful brand new building, 2 floors right on Urban Community School's campus. And we are going to offer a full range of primary care here. So we're going to have doctor's offices for kids, adults. We're going to have express care if you need same-day things. We're going to have a whole range of support services like behavioral health, nutrition, WIC, social work. There's going to be the ability for us to work as teams. And so every member of the team interacts with all the other members. And in that way, we can provide really seamless, integrated care. So it's just a really beautiful, cool new building that has a lot of services available for this community.
In this particular building, we've tripled the number of family medicine rooms that we have at our old center. And we also have behavioral health all in the same building.
Hello.
I think what makes it most convenient.
All right, and there we are again, and I think we have sound now. I am so sorry, everybody, for that. If you're watching and you can hear our guests when they're about to say something again, please let me know.
I just put the question out there. No one's responded yet, so we'll see.
All right. Well, again, hello, everyone. Thank you for having us. We're excited to be here today.
Yep, I got the thumbs up. I think we're good.
All right, wonderful.
Okay.
Perfect. I'm so sorry about that. I don't know what's going on. My technology has not been my friend the last couple of days. So my apologies, but here we are. Like I said earlier, you heard my voice. I was the only person you heard, so I'm not going to repeat myself again. Katie and Josh, welcome.
Well, thank you. I was saying before on mute. So I'm very excited to be on the program, also because I'm officially an Ohio City resident as of this month. My wife, Molly, who's tuning in from home, director of ed for intergenerational schools, and I just moved into a little place on 38th with our 2-year-old son. So it's a special pleasure for us to be on the show today.
Yeah, and I'm also a neighbor, Detroit Shoreway. Right on that border, I'm at 54th and Franklin, so definitely in walking distance to the new MetroHealth site and to Urban Community School. So nice to be in the neighborhood.
And good to have our neighbors and our residents on the show today. And I was saying hi to Molly because I didn't know that Molly was married to Josh. So the last names were throwing me off. So hi, Molly, and thanks for tuning in. So I guess we'll get into a little bit of about the collaboration, the facility expansion. One of you, please feel free to just start describing that project. How did it come to be?
I think it was just kind of perfect timing. I think both MetroHealth as well as Urban Community School, like the leaders of both of our institutions, Dr. Boutros and Tom Gill, really are all about community. I mean, MetroHealth's mission is about leading the way to healthier you and a healthier community. Urban is really focused on what happens outside the classroom. We both know that health and education aren't in buildings. So really, how could we partner together? And at the time, MetroHealth has been in the neighborhood for a long time with our old site at McCafferty. And when the opportunity came up to really grow something, expand our services, and have a new space, I think it was a perfect fit for people that want to serve not just students at the school, not just patients that are in, the MetroHealth facility, but the whole community. It was the right time, and the leaders really wanted to make that a big priority.
Awesome.
Yeah, no, for us, Urban was opened 52 years ago by Ursuline sisters, and our commitment from the beginning has been to serve the whole child, and then with the hope of meeting the needs of the entire family. And obviously, health is essential to that commitment. We feel the impact of health inequity on our campus every day, like many institutions in Cleveland. So when this opportunity arose to guarantee access to our students and families, it just seemed like a natural evolution of our core mission.
And I think it was exciting too. So I oversee our school health program, which we have a variety of partnerships across the county with CMSD, the Cleveland Metropolitan School District, with PEP schools, as well as with the Cleveland Heights School District. But this allowed us to have a different partnership and kind of explore a few different ways of doing things. So it was exciting to kind of challenge what we're doing and grow in a new way too.
That's awesome. I know I am really, really excited about this project. I think it's a great location. I'm so very excited. I'm excited to hear about it. I'm excited that Urban is a part of this. And I'm pretty sure I just said excited like 5 times. So if that doesn't convince you, I don't know what is going to. So I just had the image up with some of the services that were provided, but do you think you could talk about some of the services that are going to be provided at the Ohio City Health Center?
Yeah, so we definitely have our clinical services, and I'm not sure if the hours were up, and they're obviously on our website. You guys can post the flyer, but we are there, the health center hours, Monday, Wednesday, Friday from 9 to 5, and Tuesday and Thursday from 9 to 8. And really exciting for us, we also have an express care there. Although Metro has 5 express cares, this is our first one on the west side. So we're really excited about that. Monday through Friday is 12 to 8, and then we are there 8 to noon on Saturdays. But really on the clinical services side, we have primary care. So we have people from individuals, providers from our family medicine department, as well as our internal medicine department. We will have pediatric care there. OB/GYN is going to be there. We have radiology services there, behavioral health, so counseling services are available, cardiology, as well as some clinical pharmacist support there. I think the other piece that's really exciting when we think about that, whether it's the whole child or the whole community, is some of the social services that we offer there. So we have a program with partnerships with legal aid that'll be there. We have social work will be there. WIC will be there. Financial counseling for individuals who need support with insurance. We have a food as medicine program. So it's really, I think, not just when we think about health, it's not just going to your provider or what you eat and everything like that. It's that social determinants. It's these big pieces of 80% of your health is what happens in your community. So what are ways that we're putting those things in place? And Josh and I are excited. We've been working on, Josh, I think July 10th, officially.
That's correct. Yes, that's right. School market, July 10th.
We're partnering with the food bank to have a school market at Urban Community. That'll be open not just to students, but once a week for the summer on Fridays. Individuals in the community as well can get fresh produce. So it's really about those unique partnerships. And Josh, do you want to talk about some of the things we've done, I guess, on the school health side that in terms of programming? So it's obviously the clinical services, but what are some of the things we've done in the building this past year?
Yeah,
before
absolutely.
Before everyone was allowed to see the fancy building?
Right. So initially in our pilot year, we focused on things like physicals, well child visits, immunizations. But big picture, I mean, it's pretty well documented that academic achievement isn't really possible if a child doesn't feel well physically, emotionally, psychologically. And it's a very real challenge, not just on the near west side, but in Cleveland. I mean, Cleveland is an epicenter for adverse childhood experiences. I think nationally about 20% of kids experience 2 or more. And here it's closer to 40%. And if you look at the mental health side, nationally 1 in 5 kids is going to experience a mental health challenge before they reach adulthood. And with our ACEs numbers, that it's highly likely that number is going to be significantly higher than the national average. And that doesn't even take into consideration the COVID disruption that we've just experienced over the past few months. So to be able to offer these preventative health care services is really key to our mission. So we're pleased to be able to do that with Metro.
You two touched on some really, really good points, and I think that's a great segue for the next question I was going to ask you. When we talk about those social determinants, just in the immediate community, based on the location of the new facility, can you talk a little bit about why this location is good for the residents that are in the immediate area in regards to access, in regards to some of those social determinants that are hurting the community right here?
Yeah, no, I think that's a great question. I think one of the things for us, obviously, MetroHealth had been in the community for a long time, right down the street. So being able to barely move, people that were already walking to our facility were still staying in their backyard, staying in their neighborhood, so they can still continue to do that. But it's also really exciting. Right in front of the building is the RTA. So there is a stop right there. So people definitely have that quick and easy access. And then it's also great that we definitely know that transportation can be a challenge. And so not only MetroHealth, we have individuals that can drive individuals from our MetroHealth van to the new site if they need it. And then it's also our managed care partners. If people, do have managed care, a lot of insurance companies will arrange transportation, and our social work and other people can help people facilitate that, because a lot of times people don't know how to navigate some of those systems. And so being able to have those social services on site that can help people guide that, I think is a real benefit.
And we're a school, but we also see ourselves as an anchor in the neighborhood. And when we looked at our school community, we saw that a significant number of our students and our families didn't necessarily have a medical home, and we're relying on things like urgent care or emergency services, which is going to be more reactive and less preventative in nature. And of the families we did have with medical homes, a good number of them already had relationships with Metro. So the partnership made sense. Obviously, our holistic emphasis on the whole child aligns very nicely with their community focus. And the other piece about it is that we're very lucky to have like high levels of parental and family engagement at our school. I mean, just to give you a sense of it, during what we called the school at home period, which was the remote learning period, we had over 70% of our students, highly engaged in our curriculum, which is a typical significant number of families involved in our food distribution program. And so because we have this high level of participation, we felt like if we could build in collaboration with Metro this facility in our backyard, we'd be able to transfer some of that institutional trust that we've developed over the years here over to that building and make it that much easier for folks to gain access to these critical services.
And I think the other piece that's been exciting is that being on a campus, Urban has a lot of, Josh, you guys have a lot of sites. You have a lot of buildings that you do a lot of different things with.
Yes.
So, which is exciting. Not everyone has that opportunity, especially with, a pre-K to 8 school and some of the other buildings that you're building for early childhood and things of that nature. So I think we're also excited of how do we partner together for the whole community. So Josh and I have been working on some ideas for some monthly programming that virtually or in person, you never know what's going to happen in the next few months or year. But, do we have a monthly night where everybody in the community is invited, students and patients and community members, where we talk about health topics, that are relevant to the people in the community so that they have access to it. And really, is this a place that the whole community can gather to learn and grow and kind of protect their health, and health being everything, not just the physical, the mental, your whole well-being.
That's amazing. It really is. I'm curious, how has the MetroHealth Center being there, has that affected, obviously things are a little bit different right now because of COVID and remote learning and whatnot, but how is that going to impact students while they're at the school? Is it going to impact, is it going to change their day-to-day or where they have access to or any of that?
The way it's going to, obviously, students are not required to opt into the MetroHealth system, of course, or to engage with the clinic. And so we have a school clinic with a nurse in that clinic where you receive all the typical services that you would receive. So every student has access to that. And then if you opt in to the Metro system, what that means is, for example, if you have a specific mental or behavioral health need, we can do an expedited coordinated referral to the clinic, potentially during the school day. So, easier for students, easier for families, but only when families are interested in participating in that process.
And so it's an access. So similar to all of our school-based health programs, this just being a little different in that the clinic's on site, we can do that preventative care where we can do the well child exam, we can do immunizations. If there's an urgent care need, we can do it, at the health center. If parents want and decide to participate, obviously we want them to have their choice wherever they want to go. We can also coordinate with them if they have a provider that is not a MetroHealth provider, but we just can be that you need your Tdap, you need that one immunization, we can do that during the school day and you go right back to class. We can be that convenience and that kind of go between. We are that available resource to the families to kind of help them navigate too, or navigate with the school as well when needed and if we're asked to.
Awesome. So you mentioned opting in, and I think this is important for our families to understand. So for folks who have jobs that do not provide medical care, as part of their benefits package, and this may be too technical of a question, just help me know how to frame it the right way. What are some suggestions you can give to parents that want to take advantage of the services that don't have medical insurance? Looking at paying full price for everything because we know medical can be extremely expensive without that coverage.
Mm-hmm. Well, we definitely know youth are eligible for a variety of different health services and insurance options. And so I think one of the great things about having youth and as well as adults have options that sometimes they're just not aware of, you know what I mean? And so I think having our financial counselors and our social work on site, they can help them navigate that. They can help them navigate the paperwork, the process, so we really connect them to make sure that they are supported and get the services that they need. And so, and as you know, MetroHealth, we are going to serve people no matter what. And we're going to help you get connected so you can have that long-term care and that you have the best access so that you can be successful, whether it's in work or in school.
So this is going to be one of your satellite locations.
Correct.
You called it something else earlier. I can't remember exactly what you said it was. When you have 5, MetroHealth has 5.
Oh, so no. So MetroHealth, we have a variety of express care locations. And so we have a variety of satellite locations. And I feel like oftentimes we're growing, and I should know that number off the top of my head, but I apologize if I do not, because we are in neighborhoods across the county. But in terms of express care, kind of those urgent needs that you would typically sometimes, we might use the emergency department for, but really we just can go in quick and out, for an urgent need. So this is our first one on the west side that we're really excited about. So it's one of 5 that we have across the county.
Nice. And it's open to anyone, not just the students, not just Ohio City.
Correct. No, that is a really great point, because I think it's an exciting partnership. But again, both MetroHealth and Urban are there about the entire community that we're serving. And so the health center hours for the primary care, for those social services, for the express care is open to anybody. You do not have to live in the Ohio City zip code or neighborhood. And so you can be right there. And I think it's really exciting too. A lot of our providers at that site, we have over 20 providers that speak Spanish. So we definitely know that's something, and we have other translation lines available. So we really, want to focus on equity and making sure people know what's going on. But we do have a lot of Spanish speaking providers as well that serve that community.
Yeah, and that's one of the exciting pieces. I mean, there's definitely content that Metro is helping us develop specifically for our school. Like we're working with the Pediatric Wellness Center to look at what might increased physical activity look like in a socially distanced environment, that kind of thing. But then a lot of the family engagement topics that we're discussing are really designed for the larger community and to benefit anybody who lives in the neighborhood.
That's excellent. That was I love this idea of a school and a health center partnered together for everything you guys have just said. I think that's just a phenomenal idea. And I'm sure that students are going to love the idea of going to get a vaccine and then going right back to class. I'm sure that's something people are just going to love.
Yeah, I actually have a...
Parents might love it. I don't know if the students will. The parents might be happy about that.
Looking for less excuse to leave class now. So no, that was really good information. And Chad, you have all the information so folks can find out more about it listed.
So yeah, there's a link that is scrolling across the bottom of the video feed. It is, let me wait for it to come back across so I can read it off to everybody. It's www.metrohealth.org/locations/Ohio City Health Center. And I'm pretty sure you can also, I tested it earlier, you can go to metrohealth.org/Ohio City and Health Center, and it'll pop up there too. It'll just redirect you. We will make sure that all the links are in the description after the video and whatnot, but I know that there's a ton of information, all the questions I could have possibly thought of asking about what's actually provided is at that link, and so it's a great resource. You can also see the video that we played during our countdown and our audio issues at that link as well, and that is just a phenomenal. And you get to hear from Katie again, because she's the very first person talking, I think. So it's a wonderful resource for everybody. Do you guys have any last little bits you want to share or shout outs you want to make?
Yeah, no, I wanted to also just add, obviously, we've definitely, I think, kind of hopefully said it multiple times that this is for the community. It is for, anyone that is in the neighborhood and throughout the city, even, and county. That's definitely Metro is committed to the county. But I also want to, if you are an urban community parent or a scholar and are watching, if you are interested in participating in the school health program where you can get the immunizations and things at school, if you go to the MetroHealth School Health Program website, and so literally just Google MetroHealth School Health Program, you'll find a link to the consent form. I also know it's on the Urban Community School website as well. And then I know people in Ohio City also go to other schools. And so Metro has a variety of schools that they serve in the Cleveland area. So if you're living in the neighborhood and are at maybe a CMSP school, if you go to that website, you can look at those consents and those sites as well, because we'd love to have you participate to make sure you're ready to learn with this upcoming academic year. Wonderful. And I want to emphasize too, I think, sorry, you're making me think of all these things last minute. I want to The center is open. I know with COVID, a lot of people are nervous sometimes about going back to health centers, but we have a lot of protections in place. Your health is our priority. And so you can get that preventative care. And when we think about back to school, there are sometimes immunizations and shots that people need, physicals. We really want to make sure you have that preventative so that you are protected and ready to learn. So do not hesitate to make that appointment. And if you even want to start with a telehealth appointment, whether it's telephone or televideo, our team can help you with that as well. So don't hesitate to reach out to us about that.
And I just want to say we didn't do this alone. I mean, we are indebted to our Metro partners. Obviously, we've got tremendous board leadership and a strong base of support. So I'm just very thankful to all those folks.
Awesome. I've got nothing else. What about you, Whitney?
Oh, I just want to add one more thing in saying the engagement aspect of it. I would love to continue that conversation with Urban and also MetroHealth, because as you mentioned earlier, Josh, or Katie, sorry, I can't remember who said it, but Urban Community School is a staple in Ohio City. Urban has opened their doors to youth events, to community gatherings, to all types of things that our residents take advantage of on a consistent basis. And I don't know if I should say this publicly at no charge.
I guess we'll find out. Yeah.
Up until now, at no charge, for some of the events that happen. So no, I'm grateful that this is happening. I think it is adding to that staple in the community, and I'm looking forward to continuing the conversation.
Absolutely. All right, thank you both so much for coming on today. We really appreciate it. Once more, we have Katie and Josh from MetroHealth and Urban Community School, respectively. Thank you both so much again. Thank you.
Yeah, thanks, Katie. Josh.
So, Whitney, it is just the two of us now. So it's the story of my day. I don't know what's happening.
It's one.
It is Friday. We've got an exciting weekend coming up because we have a cleanup. You want to talk about that this week?
Sure. So Irishtown Bend is a green space right behind Ohio City Farm. We have quite a few partners working to make it a larger green space park, within the next few years. So this is the kickoff event. We will be hosting a cleanup tomorrow from 10 a.m. to 5 p.m. Come on out for an hour or however long you'd like to come during that time and help to get that space, show it some love.
Wonderful.
Community, so you should see some people that you know.
Wonderful. And so that is the parking lot on 25th, 1477 West 25th Street parking lot is where we're meeting.
That's where we'll meet.
Yep. It's not too late to register. Go to irishtown-bin-cleanup at eventbrite.com, right?
Yes.
Perfect. And I'm really excited. One of my favorite projects that I've seen in Cleveland is the Clean and Green trailer, and so we'll have that available. So we'll have all sorts of supplies. I think it's going to be a lot of fun, and hopefully the weather holds up.
And refreshments and water. I do hope the weather holds up too. We should get a good chunk of the day. We'll provide rubber gloves. We're asking people to adhere to COVID-19 safety guidelines, wear your mask, keep at least a minimum of a 6-foot distance from each other. So that way everyone feels comfortable playing their part.
Perfect. And the text line, we're still doing the text line, right?
Are still doing a text line. So one thing we also wanted to address is the digital divide. So if you're looking at this, we are aware that it's online. Please share this information with your non-digital cohorts, your friends, your family, your neighbors. We are able to share Ohio City community updates by text at this point. We've been doing it since COVID-19 kicked in, kind of threw a lot of things off track. So text the word subscribe to 216-250-1919, and you'll begin receiving weekly updates.
Wonderful. And I think that's all of the updates we have. Can you think of anything else, Whitney? Did we miss anything?
The only thing, we still have our coronavirus resources on the Ohio City website, on the Ohio City Inc. website. So if you want to find out, we'll be updating that very shortly, but some of the items are still in place. You can still take advantage of. Just go to www.ohiocity.org/COVID-19.
Wonderful. Easy enough. There is one more update I just thought about, and that is next week. Next week is the 4th of July weekend, and we will actually not be having an episode of Ohio City TV on Friday, and so you'll have to tune in. I believe it is the 10th is when we'll actually have our next episode. So it's going to be 2 weeks before you get to see our wonderful faces on here again. But we should be back in a couple of weeks with a lot of exciting stuff going on. So that's all Absolutely. Have a safe weekend. Come on out tomorrow and help us clean up the Irishtown Bend area. Stay safe, stay healthy. Have a great day.